It's been a good week for Alberta First Nations. To start with, a long-standing land claim with the Siksika First Nation east of Calgary has been settled, and the Enoch First Nation west of Edmonton has announced the construction of a charter surgical facility on their land. Both good news things. Starting with the Siksika settlement, while many modern interpretations of treaty obligations have been dubious, one thing that it has been crystal clear within all treaties has been the delineation of borders within the reserves. Treaties are usually pretty simple documents, and they're all online to be seen. Now, Canada changed the terms after the fact with the Siksika Reserve and took a large chunk of their land away from them. Hopefully, the settlement announced will lead to some final resolution so folks can start looking forward instead of back. And in fact, one of the Siksika elders said precisely that during the press event on the reserve yesterday, and it was heartening to hear. Now, on to the fantastic new venture announced by the Enoch Cree First Nation. Chief Billy Morin has been heading the Enoch Cree since 2015, and he hit the ground running. He's a pragmatic young leader, and he intends to diversify the economy on his reserve, predominantly through healthcare services. So Morin has spoken in the past of setting things up from birthing centers to research facilities for diabetes. He sees an opportunity for his people in the field of health due to the rigid regulations hindering development of private facilities off of reserve land. It's a real creative idea. The first big healthcare facility on his reserve is now set to be built next year. The Enoch Cree Nation has partnered with Surgical Centers Incorporated to open up a surgical center that's going to offer up to 3,000, publicly funded, still in the health system, people aren't paying out of pocket, knee and hip replacements a year. This would work in conjunction with Alberta Health Services, and the provincial government appears eager to help the project along. Now, waiting lists for healthcare in Canada's socialized healthcare system are terrible, and they've been growing. In Alberta, it takes an average of 26 weeks just to get a surgical consultation for a knee or hip replacement. After that, it takes nearly a year on average to actually get the surgical procedure done. So you're talking a year and change from pain to treatment in this system. Meanwhile, patients are in a painful, debilitated condition. They're often out of work while waiting for surgery, and they're taking a lot of painkillers. We got to shorten these times. The new center on the Enoch Cree Reserve will be a godsend for thousands of Albertans. Facilities providing private care within the public system are vulnerable to Canada's ideologically driven environment. While the Canby Clinic in BC was a great success, it's under constant legal attack from the NDP government that opposes all private care, even if it benefits patients and taxpayers alike. It makes Canada a difficult and risky place for healthcare investments. With Canadian First Nations getting in on the private provision of healthcare, though, we could be seeing a game changer. First Nations exist in a semi-autonomous state within Canada. Reserves are largely self-governing, and they're exempt from many local laws. That's why you can still smoke indoors at a First Nations casino, for example. If a First Nations healthcare facility faces legal challenges from leftist governments, the challenges will probably lose. And even if the challenge wins, a reserve can be inclined to tell the courts to get stuffed, and there won't be much repercussion. While the left would rather have people die on waiting lists than reform the healthcare system, they'd also rather walk on hot coals barefoot before getting into a battle with First Nations. How would it look if Rachel Notley became premier again? It would look bad in a number of ways, but then she tried to shut down the healthcare facility on the Enoch Cree Reserve. How many people on reserves would she be willing to put out of work? Most major cities in Western Canada have First Nation reserves, either near or bounding upon them. I imagine the Tsuut'ina Nation west of Calgary is watching the Enoch Cree project with interest. And the Siksika Reserve could be considering healthcare centers as a place to invest their $1.3 billion that they just recently got. A private imaging clinic offering MRI and CT services owned by the James Smith Cree Nation actually has been operating successfully in Saskatoon since 2020. And they might plan on expanding as well. Medical centers on First Nations land are win-win-win. Revenue and skilled jobs are brought to First Nations reserves. Waiting lists for medical procedures in the public system will be reduced, and the system will likely save money in the process. Let's hope the Enoch Cree Surgical Center is just the first among dozens we're going to see on First Nations reserves across Canada.